Here, boy. Okay, so just wanted to go through some of the horse's dental anatomy a little bit, and also just show you what we're actually doing when we're performing a dental treatment. This is a skull from a young horse. I'll explain in a moment how we know that. And so essentially what you have is you've got the upper jaw, which is called the maxillae, and the lower jaw, which is the mandible. And you'll see, if you look at it, that the upper jaw is wider, the maxilla is wider than the mandible. And when the horse is chewing, it's chewing in a sort of side-to-side motion like this. If we take this upper jaw off, and we can just have a look at what teeth are present inside the horse's mouth. So right at the front of the mouth, we've got the incisors here, and these are used for cutting grass or hay. You know, when the horse is grazing. And then if we come back from the incisors, we're quite fortunate. This horse has got wolf teeth. Okay, so the next teeth we come to in the horse's mouth are the really important ones. These are we call these the cheek teeth. You could refer to them as premolars and molars, but in actual fact, in horses, the morphology of those teeth is identical. So we just call them all cheek teeth for simplicity. We said earlier that this is a young horse. We can see that there should be in each arcade in a mature horse 6 cheek teeth in each row, and we've got 1, 2, 3, 4 here, which tells us we've got a yearling, and we've still got 2 more teeth to erupt. And these 3 teeth at the front are deciduous or baby teeth. They will be replaced by permanent cheek teeth. The thing to notice is that they have a very irregular surface, and this is essential for grinding down the food into a nice sort of small particle size, which allows the horse to get all the nutrients that they need from their sort of essentially very fibrous diet. You'll notice as well that these teeth, they're not perfectly flat across the surface, but they're angled slightly, and it's the same on the uppers, a slight angle. When the horse is chewing, these teeth they're wearing down. They're sort of soft in comparison to our own teeth, so they have a rate of attrition, but at the same time as they're wearing down, they're erupting from within the skull. And the result of that is that the size of the crown remains more or less the same, but the tooth is continually erupting and wearing down. Because of this angulation and the fact that we've got tissues of different hardness on the tooth, you've got enamel, dentine, and cementum, and the enamel is very, very hard compared with the other tissues within the tooth. That gives you a nice irregular surface, but it also means that over time domestic horses will often develop these sort of sharp points, usually along the inside of their lower teeth and the outside of their upper teeth. So when we come to do your horse's teeth, the sort of vast majority of the time, what we're doing is removing these sharp enamel points. So with our rasp, we will be coming up the inside of these lower teeth, like that, and along the outside of the upper teeth, and taking those sharp enamel points off, because particularly in horses that are ridden, that are wearing bridles and tack, these sharp enamel points on the outsides of the upper teeth will impinge on the cheeks, and they can cause soft tissue damage or discomfort. So that's that's what we're doing the majority of the time with routine prophylactic sort of dental treatment. Okay, so this here is a canine tooth, usually only present in males, although some females might have small sort of rudimentary canine teeth. They don't have any sort of useful purpose. It's just a sort of male characteristic. Okay, so this is the skull from a mature adult horse. It has some parts of it cut away for demonstration purposes. We can see that this is still a young horse, but it has all its permanent dentition through. So it's older than 5-year-old. This is an interesting thing for you to see. Here we have the crown of the tooth, the bit of the tooth that you will see inside the horse's mouth. And then if you look here, we're actually looking inside this horse's maxillary sinus, and you can see all of this, which we call reserve crown. This is the part of the tooth that is going to continue to erupt through life. As this bit wears away, this bit's going to come down. The result of that is a younger horse will have a very long tooth inside its head, and an older horse will have a much shorter tooth. And then at the top of this reserve crown, you've got the roots, or the apex as we call it. I'll just open up the mouth, and you can see there we have a full mouth, 6 cheek teeth in a row. We've got 1 or 2 teeth missing in this horse, but as I say, these teeth should be very, very firmly packed together. There shouldn't really be any space at all between these teeth, and that gives them the effect of working as one sort of functional grinding unit, very efficient for grinding down fibrous feeds.